On an individual level, things that help all of us. An important thing is to do what helps you and your family personally. So you know what works for you and you know what works for your family. If you're a family that sits around and talks about things, that may well be the best way to help things. But it doesn't work for everyone. It may be better to sort of go out on a walk on the family, do something physical, something that works for you. Very importantly, take one step at a time. So a lot of us have got very real problems to deal with, and we want to get on with them and we want to solve them, but they're not going to solve instantly. It needs to be a very gradual process, and we have very little control in a lot of that, which is quite an uncomfortable feeling. But it's about setting realistic goals and managing your way through those. Saying no to taking on too many things. It's very easy for us at the moment to just say, yes, I'll do that, I'll do this, I'll do that. But it actually starts building up, and we really need to conserve our resources personally at the moment. Being tolerant to yourself. So recognising that this is and has been a very difficult year, and that maybe things aren't going perfectly. So not being too hard on yourself and not being too hard on other people. That recognising that we're all struggling, balancing a lot of things at the moment. Putting the fun back in our lives. That seems a really funny, strange thing to talk about, but it is actually really important. I think it has been one of the first things that's dropped off. We sort of feel guilty about having fun when we've got so much else to deal with. And it's sort of difficult to do that, or it certainly was in Christchurch. You know, sporting facilities aren't open, the beaches weren't open, but now they are. But it is a really important thing. Put fun back into your life and your family's life. And then really simple, not rocket science things, but things that do really help. Sleep regularly, eat regularly, and exercise. Exercise really does help. It helps reduce physical muscle tension, and it really does help your head, helps clear your head. Don't use substances excessively. It's a very slippery slope to go down. It's a very easy slope to go down, but drinking too much, using drugs only comes with its own problems. Getting involved with things. So these projects I was talking about, either within your family or within your workplace or your community. Really good to take on some things, not too much, but some things that you're really interested in, or learning new things, really getting things moving again in a positive direction. And I've sort of talked about this in the community and the workplace. Make it a very cooperative place to be, that we all feel we've got a say and something that will be listened to. So I talked a bit about previously that we've all been through really difficult times, and this figure in blue sort of indicates that. So it shows that, you know, after the event, our functioning certainly dropped off. I think we all weren't sleeping well, we weren't concentrating, we were living with that heightened level of stress, we were jumping all the time. It was a difficult time. Certainly that's what I experienced. It is turning the corner, I think, probably as time's gone on and the frequency of the aftershocks is, touch wood, reducing. And we are starting to come back, but we're not back up to where we were for most people, I think. And I think that's been because things have gone on for so long. This other line I just want to spend a little bit of time talking about now, which is, in some people, their functioning reduced, just like all of us, but it isn't starting to turn the corner and come back up to normal. Now that is probably a relatively small percent of people, but it's that group of people that I think we just want to spend a bit of time talking about, because I think it is emphasising that this is a time where if things aren't coming back to normal, if your functioning is not as good as it was in terms of you're not being able to go to work or you're avoiding things a lot, it is a time to be seeking help. So the question of when and who are the people that need to seek further help. I just put a point at the top there. I do think it's really important that as much as possible we deal with the very practical issues that people are dealing with. So the sooner and the most effectively that these very real issues about accommodation, relocation, work, finances are dealt with, that will help a lot of people. But there are some people who are presenting now or have difficulties with persistent low mood, feeling really that they're struggling to get pleasure out of life, that they're feeling less hopeful, and for some people having suicidal thoughts, and they really do need to get help as soon as possible. People who are persistently ruminating, going over and over events, or persistently having memories of the earthquakes flashing into their heads, things like that are real indicators to start getting some help. Feeling that levels of anxiety and that hyper-arousal and feeling on edge just aren't reducing a bit now. And people who are avoiding more, becoming more withdrawn. And that's a group of people that we do need to be looking out for. So neighbours, family members, colleagues, where we're seeing that. And then we're also seeing people who are developing some significant relationship problems, so rates of domestic violence going up, and alcohol or drug abuse or dependence developing now. And again, that's a real indicators for getting help. Because we do know that in a small percentage of people that mental health problems can develop. And these are in the realms of depression, persistent low mood, anxiety, and post-traumatic stress disorder, where people are having recurrent memories of the events, they're having nightmares about them, they're feeling like they're reliving those experiences, they're very anxious, very avoidant, very on edge. And the other issues that we know are likely to develop are those of substance abuse and dependence, alcohol and drugs, and relationship problems. The literature on research on disasters would suggest that the people who are most at risk of developing mental health problems are those with previous difficulties, particularly those with anxiety or previous trauma, those who have been highly exposed, so people who've lost a lot in the earthquakes or found them very frightening, or those who've been very financially affected or lost their homes or lost their businesses. We also know that people who've got limited social supports are at increased risk. High-risk professions like rescue workers, police, ambulance, firemen, builders who are dealing with demolition and things like that. And then a new group of people really who've had none of those difficulties, none of those risk factors, and often have had no previous difficulties at all, that have been really quite in control people. And it feels like the earthquakes have really disrupted that sense of control very powerfully for them. We also know that some people don't seek help or are quite reluctant to seek help. And there are various reasons because of that. Some people think they should just be able to get over it on their own. Some people think other people have had much worse experiences than them, and they almost feel guilty thinking that they should be getting help. And then the stigma of getting help in the context of all this, which is still prevalent. But it is really important to know that people can get help. There's really effective help, and these symptoms and these problems don't need to be ongoing. This is just a quote I wanted to put in from Helen Keller, who was an American lady who was deaf and blind. And she was a great speaker and writer of speeches. And she said, although the world is full of suffering, it is also full of the overcoming of it. And I think we really need to remember that we have suffered an awful lot, but also we are able to overcome an awful lot as well. So not forgetting how we as humans are actually hardwired to come through events like that. But some people do need help, and they do need to get it. So this is just in summary. acknowledging that some people do need to get help, and now is the time where that might be becoming more evident, but that the vast majority of people who've been through disasters do not develop long-term mental health difficulties. And often we learn that we can handle crises not perfectly, but really effectively. And I think this is very true for Canterbury. It does bring communities closer together, closer than they've ever been, and reorientates it to values about what is really important in life, and to allow us to move on from this and actually truly to move into a better place than we were before.